This month and last, the ophthalmologists have provided benchmarking analyses, first for cataract and now for glaucoma. Why are we doing this? The idea is to provide some reference points against which you can judge performance and progress by. It's widely applied across society. Governments use it to monitor departments, sports teams are measured by these benchmarking statistics, and of course we can measure the scientific and medical progress by the same measures. Ophthalmologist benchmarking analyses, we try to assess who publishes what and where and by what impact. And what troubles me with the analyses is the use of the impact factor. It's a widely used, quick and dirty assessment of journal quality, but I think its importance has been massively overstated over the years. Even since it was first introduced, people have been trying to improve it for good reason, and even the creator of it, Gene Garfield, knows that it's not sufficiently good enough to judge scientific quality accurately. So why is it used? It's easy and it's available, you can get them without any problem. There are better metrics out there, Sciamago, eigenfactors, but they're expensive to access and then people aren't familiar with them, so there's that hurdle there as well. But the problem with impact factor is that journals, their impact factor is massively determined by just a few superstar citation papers. They support a long tail of approximately 70 to 80% of papers which are hardly cited, but there's a few superstars up the front which comprise most of its impact factor. This applies equally to Nature as it does to journals with the lowest of low impact factors. However, the efforts to improve impact factors basically came up with how Google works. In the late 1970s, people were trying to improve an impact factor and they decided to use weighting to assess the quality of the work. So higher impact or higher quality journals were given a greater weighting than lower quality journals, and this is exactly how Google's PageRank algorithm works. So, as any web developer will tell you, it's actually this sort of exposure, this sort of ranking that gets you noticed, the Google search index. Nobody gets into ophthalmology for exposure, but if you're competing for research funding, it truly is important. Life is a pitch. It's all about selling your knowledge and skills to the world, getting the kudos and the career advancement opportunities that this exposure gets you. So, with that in mind, choose carefully about where you place your work.